Good afternoon, everyone. My name is Robert Craig. I'm Executive Director of Citizen Action of Wisconsin, so we're a statewide membership organization that works on guaranteeing health care for everyone and other issues, but that's our lead issue. And in Wisconsin, we're organizing cooperatives. It is the Citizen Action North Central Wisconsin Organizing Cooperative, and all the folks here are members or heavily involved in Citizen Action here in North Central Wisconsin. So we're here this week because this week is the budget week where Governor Evers is going to introduce his first budget Thursday night. And one of the biggest issues in the election, and years before actually in previous budgets, and will be in his budget address, is the issue of taking all of the extra federal Medicaid expansion money to expand Badgercare, which Governor Walker had refused to do starting in 2014 when it was first available, leaving Wisconsin the only state in the upper Midwest and any Great Lakes state that had not taken the money. 37 of the 50 states have taken the money. Most of those who have not are in the deep South. So Wisconsin's been a real outlier. And the result has been that we're leaving federal money on the table that was earmarked for Wisconsin, partly Wisconsin taxpayer money, and leaving 75,000, roughly, according to state estimates, people without affordable coverage who are low-income working people. Almost all the people in this area work, but they work at jobs that don't provide good health benefits. People who provide in-home care, child care, retail workers, landscapers, a lot of those kind of jobs, or people who don't have an employer, right? People who are self-employed, people who are farmers don't have an employer. These are all folks that don't have good insurance at work, and if they're low enough income level, they would have been eligible for Badgercare, which is an excellent program, except for this very political refusal to leave money on the table and just not take it. And so makes a lot of common sense. Governor Evers ran on this, is very committed to it, but there is still opposition from the leaders of both houses who are Republicans, Robin Vos and Scott Fitzgerald. So we anticipate this being one of the big issues in the budget debate that occurs in the whole public process. And we think that it's going to be, quite frankly, one of the most popular positions in the Evers budget. The polling from Marquette University Law Poll shows that 62% support, 25% oppose, so one of the highest polling issues, and it cut across demographics. 25% of rural people in rural areas support taking the money. Over 30% of independent voters support taking the money. 10% of people who describe themselves as conservatives support taking the money, and even self-identified Republicans support taking the money by 3 percentage points. So this is overwhelmingly popular. The only reason it hasn't been happening is not a good public policy reason, but pure politics. That is, some politicians thinking that they want to oppose anything that was part of the Affordable Care Act no matter what. And that is not a good reason to turn down this money. It is in fact playing politics with people's health. And I don't think the voters will accept that anymore. And in this election, healthcare was by far the top issue. And this is the first clear thing that we can do to expand access to quality, affordable healthcare. And if you think about it, quite frankly, people think that everyone ought to have a right to get health care when they need it in some fashion. And in fact, a lot of folks who should have had access to health care were thrown off Badgercare when this decision was made in 2014, and more are being denied access because they don't have access to the clearest, the most affordable way to get health care, and the best way to get it if you're moderate income, and that's Badgercare. And so this expansion of Badgercare would be very good for a lot of people struggling to move up the economic ladder and to get health care, and it is taking health care away as much as denying health care based on a pre-existing condition. It's really about the basic principle that no politician in Madison, no big insurance company should be able to deny you health care when you need it. It's that simple, that it's a fundamental human right, and this is part of the path to eventually establishing health care as a right in Wisconsin and in this country. And I know we have a couple speakers here from different counties, but I will not give the numbers from their counties. But in order to try to show the legislature and show Governor Walker when this money was turned down that was popular, back in 2014 there were referendums across the state. And around this area, 72% voted for it in Portage County, 70% in Wood County, and in heavily Republican Clark County, 58% voted yes for taking the money. And we have a couple other counties represented here where they can talk about the result in their county, and they can also talk about from the standpoint of county government, because county government provides human services. So a lot of the times county supervisors see more clearly than state legislators the impact of turning down money for health care. So our next speaker is going to be Hans Brittenmoser from the Lincoln County Board, a county supervisor, to talk about Lincoln County and the impact of taking this money there. So Hans is, of course, a member of the Citizen Action Wisconsin Northeast Wisconsin Co-op. So Hans, thank you for coming.
Thank you. Well, I don't know what I can add that Dr. Craig hasn't said way better than I ever would be able to. But I guess I come at it from a slightly different perspective as a small business owner and as a county board supervisor. I think you're absolutely correct. You know, those of us who are on the ground and county government have a different perspective compared to, you know, our politicians in Madison. But looking at it from just a rural economic standpoint, and I suspect it's the same for urban areas, but in rural areas, you know, a lot of the things that we struggle with are you know, small business type of things. And what I can't stress enough in our area in Lincoln County is that there's a lot of small businesses who, if they didn't have such a burdensome, complicated, and expensive situation with regard to their health care coverage, they would be in a lot better shape. And perhaps more importantly, we have a lot of people who would be entrepreneurs, except for they're, you know, sort of scared to stick their neck out there and leave a job that has health insurance to sort of take a chance because they, you know, their instinct is to do the responsible thing and make sure they've got health insurance coverage for their children and so forth. But it is tough on small businesses because the system is not only expensive, but it is complicated and terribly difficult to navigate. And I think, as Dr. Craig said, this is not a partisan issue. In Lincoln County, 67% of the voters in Lincoln County said, yes, we need to go ahead and accept this money. And as was also stated, some of this is our money. Why wouldn't we leave it on the table? It seems illogical. So this is the definition of common sense. This is good for small businesses. It's good for rural economies. It's good for people's health care. And it's, you know, we have every right to that money, and it would be silly to just continue on. Nobody's running for president here now anymore, so we don't have to worry about that. There's no reason that this money shouldn't be taken.
Thank you very much, Hans. And he is so right about people taking risks. Being an entrepreneur, working for a small business, only a third of small businesses can afford to provide coverage. Doing something else like taking care of a sick parent or relative becomes a problem. And a lot of the people on Badgercare, it's temporary. You know, they might go and be an entrepreneur for a year, be very low income, then they're successful, or they build up a small business, or they work for one, and then they get their health insurance and are able to afford it. And so it's a clear kind of safety net for everyone. If you get a major disease like cancer, you lose your assets, you lose your job, you eventually become Badgercare eligible. If you make it harder to get, then you may not be as likely to survive cancer, just for example, because that safety net wasn't there. So it's something that impacts everyone eventually, whether they need it right now or not. Or if you retire early and there's just a couple years where you're low income, this kid ties you over to Medicare, just for example. And so with that, we will go to another county, Oneida County. And so Stephen Schreier is here to talk about Oneida County. And also, Hans, I don't know if you mentioned did you mention the Lincoln County referendum number?
Yes.
I'm not sure you did, okay.
I think I did, 67%.
67% in Lincoln County voted for. But now here is Oneida County. Stephen, thank you for joining us.
Thank you for inviting me. Recently, when I was down in Madison, I had the opportunity to tour the Capitol building, and I was struck by a phrase that was there inside the governor's conference area where a lot of decision making gets made. And it basically says, the will of the people is the law of the land. And I think that when you have a referendum that resoundingly sends a message to our legislators down in Madison that this is something we want, this is something that we deserve. And we've already paid for it technically. That's the irony of it. The money's gone out to the feds, and then it sits there or it gets sent down to the southern states who have as many needs as we have here in Wisconsin, but that doesn't mean that we shouldn't be getting back the money that we paid into the system through our taxes. I believe that we struggle to provide the services because of that, especially in the Northwoods. And I'm not surprised that almost every single county in the Northwoods that had this on referendum, it passed very resoundingly. If it was at least the upper 60s, close to 70%, which statewide was the same thing. Very few counties other than maybe Clark had a lower number on there. So again, why we don't respond to what specifically is asked by the people when they take their concerns to the voting polls is beyond me. And it's about time we do that. I'm optimistic that this current new administration is going to take advantage of that and that we're going to see sea change soon. Thank you.
Thank you very much.